Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about lung infections. Pneumonia means infection of the alveoli. This occurs inhaled or bloodborne microbes reaching and colonizing the lungs. The following are some predisposing factors. Impaired coughing. Coughing is an effective cleaning mechanism, but if it is impaired or lost by, for example, damage to respiratory muscles or the nerves supplying them, or painful coughing, then respiratory secretions may accumulate and become infected. Damage to the epithelial lining of the tract. Ciliary actions may be impaired or the epithelium destroyed by, example, tobacco smoking, inhaling noxious gases, infections. Impaired alveolar phagocytosis, depressed macrophage activity may be caused by tobacco smoking, alcohol, anoxia, oxygen toxicity. Hospitalization, especially when mechanically assisted ventilation is required. Some other factors, the risk of pneumonia is increased in extreme of age, leukopenia, chronic diseases, example heart failure, cancer, chronic renal failure, alcoholism. Suppression of immunity caused by, for example, ionizing radiation, corticosteroid drugs, hypothermia. Next one. There is a frequently incomplete resolution with fibrosis. Bronchitis is a common complication leading to further acute attacks. Lung fibrosis and progressive destruction of lung substances. Lung disease, example, bronchitis, cystic fibrosis, or acute viral infections. General anesthesia, which depresses respiratory and ciliary activity. Inhalation of gastric content, that is unconsciousness, very deep sleep, following excessive alcohol consumptions, drug overdose. Inhalation of infected materials from the paranasal sinuses or upper respiratory tract. Lung abscess. This is localized suppuration and necrosis within lung substances. Sources of infection. The abscess may develop from local infections if pneumonia is inadequately treated as a result of trauma, rib failure, rib fracture, stab wounded, or surgery of adjacent structures. Occasionally, lung abscess develops when infected material traveling in the bloodstream, a septic embolus, arises and lodges in the lung. Such material usually originates from thrombophlebitis or infective endocarditis. Next is tuberculosis, TB. TB is a major health problem worldwide, particularly in low-income countries that cannot afford effective prevention or treatment, and in countries where HIV disease is common. It is caused by one of two similar forms of mycobacteria, the main one being Mycobacterium tuberculosis. Humans are the main host. The microbes are spread by inhalation, either by aerosol droplet infections from an individual with active tuberculosis or in dust contaminated by infected sputum. Less commonly in developed countries because of pasteurization of milk, TB can be caused by Mycobacterium bovis. from cows. Pulmonary tuberculosis, that is primary tuberculosis. Initial infection usually involves the apex of the lung. Inflammatory cells, including macrophages and lymphocytes, are recruited in defense, sealing off the infected lesions and bone foci. Secondary TB. This is usually due to reactivation of disease from latent bacteria surviving primary TB and can occur decades after the initial exposure in response to factors such as stress, aging, immunocompromise, or malnutrition. Further, secondary TB, this is usually due to reactivation of diseases from latent bacteria surviving primary TB and can occur decades after the initial exposure in response to factors such as stress, aging, immunocompromise, or malnutrition. Non-pulmonary TB. Primary TB rarely affects tissues other than the lung, but non-pulmonary involvement in secondary TB is very common. Widely disseminated TB is nearly always fatal unless adequately treated. Biliary TB. Blood-borne spread from the lungs leads to widespread dissemination of the bacilli throughout body tissues, and foci of infection can establish in any organ, including the bone marrow, liver, spleen, kidneys, and CNS. Numerous tiny nodules develop in the lungs, which on X-ray look like sprinkled millet seeds. Rapid treatment is essential to prevent further spread. Lymph node TB. This is the second commented site of infection after the lung. Lymph node in the mediastinum, neck, axilla, and groin are most likely to be affected. Joint and bone TB. The intervertebral, hip, and knee joints are most commonly affected and in children are usually a consequence of primary TB. Other affected tissues, the pericardium, skin, and G1 tract may be all become involved. Now we'll discuss further detail about lung infection. Lung infection are caused by viruses, bacteria, or fungi entering the lungs, leading to inflammation, fluid buildup in their air sacs, alveoli, and symptoms like coughing, fever, and difficulty breathing. Examples include pneumonia and bronchitis, which inflame the airways and air sacs, making it hard for oxygen to enter the bloodstream. The body's immune cells attempt to fight the infections, but this can cause symptoms and severe cases can lead to chronic respiratory problem. Types of lung infections: pneumonia, an inflammation of the lungs air sacs alveoli that can be caused by bacteria, viruses, or fungi. Pneumonia is an infection that causes the lungs air sacs alveoli to fill with fluid or pus, leading to inflammation and difficulty breathing. It is typically caused by bacteria, viruses, or fungi. Symptoms vary but often include a cough, fever, chills, and shortness of breath. Treatment depends on the cause, with antibiotics used for pneumonia, bacterial pneumonia, and supportive care for the most viral cases. High risk groups include young children, older adults, 65 plus, and people with weakened immune system or chronic health conditions. Bronchitis. Inflammation of the bronchi airways that leads to coughing, shortness of breath, and wheezing. Bronchitis is a lung condition that involves the inflammation of the bronchial tubes, that is airways in the lungs, leading to a cough, often with mucus. There are two types. Acute bronchitis are short-term conditions typically caused by the viral infections that last a few weeks, and chronic bronchitis, a long-term conditions that causes persistent symptoms and is often linked to smoking and long-term exposure to irritants. Symptoms include coughing, wheezing, shortness of breath, fatigue, and chest discomfort. Next, TB, tuberculosis, the bacterial infection that primarily affects the lungs but can spread to other parts of the body. Tuberculosis is a preventable and curable infectious disease caused by Mycobacterium tuberculosis bacteria, primarily affecting the lungs but also other body parts. It spreads through the air when a person with active TB coughs, sneezes, or speaks. There are two types of TB: latent infections, that is, bacteria are in the body but not causing illness, and active TB diseases, illness with symptoms. While latent TB is not transmissible, active TB disease is contagious and can be fatal if untreated, but it is treatable with antibiotics. Lung abscesses, pus-filled cavities in the lung tissues, often resulting from untreated bacterial infections, that is, lung abscess. Lung abscess is a serious lung infection that creates a pus-filled cavity in the lung, often resulting from the bacterial aspiration. Symptoms include chest pain, fever, persistent cough producing foul smelling or bloody sputum, fatigue, and weight loss. The treatment of typical involves prolonged antibiotics therapy and, in some cases, drainage or even surgical removal by the necessary. Maybe necessary. How lung infections affect the lungs. Pathogen invasion. Viruses, bacteria, or fungi invade the lungs. Immune response. The body's immune cells, such as neutrophils respond to the infection. Inflammation and fluid buildup. The immune response causes inflammation in their airways and air sacs. The alveoli can fill with fluid or pus. Impaired gas exchange. The fluid-filled alveoli hinder the process of oxygen entering the bloodstream. Symptoms of lung infections: chest congestion, difficulty breathing, coughing, wheezing, fever, shortness of breath, and chest pain. Prevention and management. Vaccination. Vaccines for illness like the flu and pneumonia can help prevent infections. Hygiene. Frequent hand washing helps prevent the spread of pathogens. Avoid smoking, irritates the respiratory system and increases the risk of lung infections. Good air quality. Maintaining good indoor and outdoor air quality reduces exposure to irritant and pathogens. Medical care. Seek medical advice for persistent or worsening respiratory symptoms to prevent complications like chronic respiratory issues or severe fatal outcomes. So far, we discussed about lung infections. We have done. Please subscribe our YouTube channel.